Hello. Remember, depression is highly treatable, manageable, and curable. It's a common illness, a mental illness, which can occur to anyone. It can be me, it can be you, your relative, your fiancé, or anybody. And basically, can be due to a stressful event. For example, loss of a beloved one, disappointments, and the other causes. And treatments or treatment plans of depression exist, and they are basically in two or three forms, whereby the first form is the non-pharmacological form. That's to say, management which does not include medicines. This can be family therapy. In this case, we family members who are related or who are relatives of the patient who is depressed have to play our part of identifying the person depressed and taking them to hospital for assessment and management. And also, we family members have to stand in for those people who are depressed. For example, if such people are admitted in hospital, we must be there as caregivers. We must be there as caretakers. In case they are experiencing a financial crisis, we family members are expected to be on the front line of people who donate finances to our relatives in financial crises. And also, we family members are expected to be the strongholds of our relatives in times of bereavement. For example, if a person loses a wife or a husband, we family members should be there to comfort them and strengthen them through that moment of grief and prevent them from getting depression. Number two, psychotherapy. Psychotherapy is a form of talk therapy which can be given by a trained health worker who is always a psychologist to a person who is having depression. It really works, and it's always systematized, process by process, from A up to Z until the patient improves with depression. Number three, the other non-pharmacological method is occupational therapy. Employers and employees should give sick leaves to people having depression for them to be able to get treatment for their health conditions, and also should initiate them back to their works or their jobs progressively until when they recover. And finally, we shall look at the social therapy. People in the community should not stigmatize individuals having depression, neither an individual who is undergoing a depressive episode or a mental breakdown. We should stand in as with love for each other, support everybody through a health hazard. And after that, we shall talk about the pharmacological methods of depression, the medicines which treat depression. There are so many types of antidepressants. For example, the tricyclic antidepressants, certain selective uptake antidepressants, and so many other types. However, the common medication commonly used in Uganda include fluoxetine, sertraline, amitriptyline, imiprin, and so many others, to mention but a few. When given by a trained health provider, a patient is expected to improve from depression. ration. But remember, patience pays. Antidepressants work progressively. Therefore, we need our caregivers and our patients to be patient with their medication until when they improve from their depressive episodes. And after the medication, in case an individual fails to improve on tablets or capsules or medication given for depression, then there is another method called the electroconvulsive therapy, known as the ECT. It's a method which is performed by a trained health care provider, whereby they put two electrodes on the temporal sides of the head and an electric current is shot into the brain of an individual. With that, after several electroconvulsive therapy doses, a person who is having severe depression is expected to improve to moderate depression, whereby that person will continue with fluoxetine and other medications until when the depressive episode resolves. Therefore, depression is highly curable and improves. Therefore, visit the hospital as soon as possible for treatment and medication. Remember, the earlier the treatment, the earlier or the better the prognosis. Therefore, visit this hospital as soon as possible. For any inquiries, post in my comment section and I will answer you. However, follow the next videos for more health updates. Thank you all.